Implant failure can be several different things.
Right.
You can have what's considered immediate implant failure.
Where you do not get stability upon placing the implant.
That would be more of like an in-surgery complication.
Oh, okay.
So when we talk about immediate implant failure, as confusing as it is, we more or less mean in the first 3 months while it's trying to heal.
Gotcha.
So that would be anything that is related to maybe you have an infection right away.
Right.
Actually, let's list those things off as we kind of come back, circle through it. But you can have immediate implant failure, so within the first 3 months.
Mm-hmm.
You can have a delayed implant failure, which would mean that we saw it at 3 months, it healed fine. Maybe 2 years later, you have it fail down the road, which can happen as well.
Sure.
And part of this podcast is to inform people, right? When I started doing this, regardless of the technique and the protocol, it was always sort of considered good salesmanship to not discuss these things, right? And I would end up doing the surgeries not understanding how misinformed this patient may or may not be.
Right.
And that can really that can be a complication in and of itself.
Sure.
Right? And so that would be something that wouldn't have been discussed, right? Like these can fail long term. Right. It is a human body. This is an inanimate object going inside you and being implanted.
Right.
And so there are things that we have to cover to discuss the good, the bad, and the ugly.
Sure.
Right? So changing that has always been a little bit of a platform that I've wanted to advance because that makes my life a lot simpler in the future. So implant failure is a good one, and that can be a variety of different things and for a variety of different reasons. And I guess to some level you could say, let's say infection,
mm-hmm.
right? You can have an infection. That infection can be as a result of poor implant placement, prior existing infection, things like that. So we have infections. What else can you think of? I have one quickly.
Yeah.
Mechanical failure. So if the bite is wrong or too off, it can overload and cause implant failure. But a complication would be the bite being off. Malocclusion is what we call it.
Right.
But the bite being off is a big thing.
Yeah.
And very underrated. There's it's hard to get a consensus. It's hard to get a group of dentists to agree on what perfect bite looks like.
Right.
Acceptable bite, I'm sure we would all pretty much agree on the same thing. But in terms of like how the mechanics, there's a lot of mechanics of the bite that most people only associate with biting down on paper and sliding their teeth around and does it touch.
Right.
But there's a lot behind the scenes and a lot of people have dedicated their entire career, not just in hybrid dentistry, but regular teeth.
Sure.
How teeth are supposed to slide and where they're supposed to slide and what teeth they're supposed to slide on, right?
Sure.
So, but the gross mechanics of bite being wrong is a big thing.
Sure.
We want to know that if you can feel something that we didn't see.
Right. Something that's going to cause TMJ issues if you're out of where you should be.
Yep.
Right.
Absolutely.
I think nerve damage can be another complication.
Nerve damage. So yes. So sticking with surgical complications. So you could have nerve damage, right? The measurements were wrong, or the approximation of what size implant was placed could invade into the nerve canal and put undue pressure on it.
Right. Sometimes
you can get a little bit of swelling from the implant, and maybe it doesn't invade and create permanent pressure or permanent paresthesia, tingling, numbness, that kind of thing. Mm-hmm. Sometimes that post-surgical swelling itself can essentially, we've all sat on our leg wrong and had a leg go numb, similar to that, where once that surgical pressure is off,
right,
or that swelling is off, then that can go down and go away. So it doesn't even have to be invading into the nerve. It just has to be around it or creating pressure.
Sure.
And while we're on that topic, a random small little one, and this podcast, by the way, is more to awaken people to these are the things that can happen. so that it's a very transparent discussion on this is what we're considering. The likelihood of these things happening is exceedingly low
Right.
when done properly.
Sure.
It's of course a risk going into it, but we could even list death as a complication.
Sure.
Something I've never come remotely close with, right? So these things can, just like you can die on an airplane as a complication of boarding an airplane. These are the things that we are discussing. It's a finicky conversation because we don't want to have people overbalance this as being a fearful, scary thing that can happen.
Right.
But we also want them to be open eyes and understand that there's a part here that can be played by many different factors.
Yeah, I think that's important. I mean, like we always talk about, we want informed patients. Informed patients are happy patients.